You've recently been diagnosed with diabetes, and I know it is a lot to deal with and that there is a lot to learn. I hope to help you understand what having diabetes means for your body and how you can best control your sugars in order to live your healthiest life. When you have diabetes, the amount of sugar in your bloodstream is too high. In a healthy body, the sugar we eat in foods is used inside our cells as energy to fuel our body. Insulin, which is made by our pancreas, acts as the key to let the sugar into our cells. When you have diabetes, there are problems with that process. Either the insulin the body makes isn't working properly, or the body isn't making enough insulin. In some cases, the body doesn't make insulin at all. There are two types of diabetes. Type 1 diabetes, previously called juvenile diabetes, is usually diagnosed in children. Type 1 diabetes is related to genetics and thought to be an autoimmune process where your body attacks the pancreas and no longer makes insulin. You were diagnosed with type 2 diabetes. This is the more common type of diabetes we see in our communities of color. Type 2 diabetes is related to being overweight and choices we make in our life each day with diet and exercise, as well as our family history. When you weigh more than recommended, your insulin doesn't work well enough, or you don't have enough insulin to keep your sugars at healthy levels, and this results in type 2 diabetes. Type 2 diabetes is diagnosed 80% more often in African Americans than in white Americans, and we are hospitalized more often. African Americans are also more likely to have the many complications of diabetes, which include kidney disease, resulting in dialysis, amputations, and blindness. This is why it is extremely important to keep your sugars well controlled. Once you are diagnosed with diabetes, it is important that you get a glucometer and learn how to monitor your sugars at home. You should work with your doctor to determine your goals for your fasting sugar in the morning. For most, it is between 80 and 120. You will also regularly follow your hemoglobin A1C. The lower your A1C, the better your control and the less complications from diabetes we expect. If you are under age 65, your goal A1C is less than 7, and if you're over age 65, your goal A1C is less than 8. It is really important to remember that the only way you can know if your sugars are running high or low is to check your sugars with your glucometer. You cannot depend on how you feel, especially since some of the symptoms when your sugars are high or low are the same. With type 2 diabetes, some people can treat their diabetes and reach their goals with healthy diet, weight loss, and exercise. Some patients will take pills which help their body to produce more insulin or help the insulin they are producing to work better. And for some, as their disease progresses, they require insulin injections. Medications are one part of treating your diabetes. Another very important part of your treatment is healthy diet and exercise. Now that you understand a bit more about diabetes and how it is treated, we want to make sure you are aware of all the resources available to support you. The first step is a class to learn more about living well with diabetes. In this class, among other things, they will teach you how to check your sugars with your glucometer, teach you about foods that increase your sugars and how to avoid them, and how to use exercise to help control your sugars. In addition to your primary care physician, your team will include an APM, which stands for Accountable Population Manager. Your APM will work closely with your physician to help you manage your diabetes and can also help with your blood pressure, cholesterol, and overall heart health. You will also have access to nutritionists, wellness coaches, and behavioral health specialists, and our entire health education department. You will need to follow up with your healthcare team at least yearly and sometimes more often when your sugars aren't well controlled. We want to make sure you have all the tools you need to control your diabetes and live your healthiest life. We are always available to you anytime you have questions or concern, and you can send a secure message through the My Doctor Online app.